This short video covers diet and nutrition after bariatric surgery. After surgery, we ask that you progress through different diet stages over a period of about 7 to 8 weeks. This is 2 weeks at thin liquids, 2 weeks at a puree texture, 2 weeks at a soft texture, and then on to normal regular foods. We ask people to avoid alcohol for at least 6 months, but ideally 1 year, and not to have any physiocarbonated drinks. So in stage 1 with your smooth liquids, the purpose of this is to allow your new sized stomach to heal and usually last 2 weeks. We will tell you on the ward if you can start all of your liquids. They should be completely smooth and you need to sip them very slowly and try to understand where you feel full. When you're drinking, try to tip fluid into your mouth rather than slurping, as that will introduce more air and more gassy bloating feeling. And really, we want you to be aiming for a pint of protein-rich fluids and then making the rest of your fluids in the day up to about 2 litres. So these are just some examples of protein-rich fluids. There's a huge variety of protein-rich fluids in products, in different things you can do. So really, your pint of protein-rich fluids can be made up of having 3 of these. So anything that's a high protein drink, you can have that 3 times a day, and that will be adequate for you in your smooth liquids. If there's any particular products or anything you had any queries about, your dietitian will be able to help you with that. When you move on to your pureed diet from your liquids, one of the dietitians will ring you from our team to make sure that you're okay with your liquids and safe to move on. And they'll also talk through the rest of the stages at that point. Your pureed diet needs to be completely smooth and completely blitzed up. There's no need to buy any fancy expensive liquidizers, just a cheap stick blender and a jug will be absolutely fine. Generally, we need people to make sure that they are having their protein first, then any fibrous fruit and vegetables, and then carbohydrates last. These are just some examples of foods that you might have at the pureed stage. This isn't a prescriptive menu, so you don't have to follow this, but it's just to give you some ideas of the sort of things that you might be able to have for each of your meals and a snack throughout the day. And just be very sensible about it. Sometimes people might prepare the food beforehand, before they have surgery, blitz it down and freeze it, or they might look at family meals that they can make that they can take parts of and puree down. After you've progressed from your pureed food, you move on to the soft and moist for stage 3. This is for around 2 weeks' time, although some people stay on it for a little bit longer. All of the soft and moist foods should be well cooked and not require a knife to eat. They really should be fork mashable, and the sort of thing that you might have would be well cooked vegetables or mince in gravy or fish in sauce. Generally, what I do say to people is if you can imagine you've got no teeth and you've got no knives in your house, that's generally the right consistency. And we want to continue to balance meals and aim for your protein, then your fibrous food, and then small amounts of carbohydrate, 3 times a day with 2 to 3 snacks. Again, these are just examples of things that you might have while on the soft and moist stage, but you can see the difference between the pureed stage and this one, where you might be able to have beef mince rather than blitzed up bolognese. You could have something like slow cooked chicken thighs that are much softer, moister, and be able to have baked beans or some soft scrambled egg. So once you can tolerate soft and moist foods, you can move on to your regular, varied, healthy diet, and your stomach should be sufficiently healed to tolerate this regular eating pattern. Really, you should be trying to choose leaner, less fatty options of protein with plenty of vegetables, salads, and those sort of things. And if you have room, then having some small portions of carbohydrates. Again, this is just an example menu of the sort of foods that you might have ongoing. You might be able to have something like a poached egg and beans for breakfast, or some low-fat Greek yogurt that provides your protein. And then for lunchtime, a bit of preparation perhaps if you're going into the office, some tuna or some chicken, some feta, broccoli, green beans. And then the evening meal, you can use things that the rest of the family are having if that's the way your household is set up. And it's really important to try and think of some snack ideas that are protein rich as well. This is more for reference for later, but these are some examples of some 10 grams and 20 gram protein sources. You'll be told by your dietitian team what your aim should be, and that might be slightly different based upon the surgery that you have and your height and your other medical conditions. But these are the examples of what you might find. Generally, you'd want to base your meals around your 20 gram protein sources and think of your 10 gram ones as snacks. But everyone's lifestyle is different, and we have to find a way that works for you. The idea of bariatric surgery is not to make sure that you're having a completely restricted diet. And in fact, if you have a normal diet as the people around you, but modify it to suit you and your requirements, you will find it easier to shop, to food prep, and generally have a better outcome. So instead of a beef burger and fries, you might have a slider and salad. Make it much smaller, reduce the carbohydrates in the bun, and swap the fries for a bit of salad. Same as having a cottage pie. Save some of the filling if you make it yourself. A little bit of mash, making your own ramekin with added veg and less potato. These are just examples again of things, but it's about getting into the mindset of thinking, what things can I have, what things can't I have, and what things can I have that everyone else can have in the household, or if I'm going out to eat, what other things can I have, and how does that fit in with my requirements, not everyone else's. At week 6 to 7 post-op, you can now go back onto taking tablets for your regular and any new medications. You now need to start your vitamin regimen and you need to contact your GP for your B12 injection. You should be starting to gently increase your exercise and activity, remembering that everyone has different levels of starting points for this. Generally, we find that sometimes people can get a bit obsessed with their weighing habit, and that can be quite unhelpful. We try and say to people, don't weigh more than once a week because you won't see significant meaningful changes, and that allows you to track yourself over a longer period of time. And sometimes some of our patients don't even weigh themselves at all other than when they come and see us. Some people do take photos, and what can be useful is to do so in the same place for context. So if you take a picture on a train, in a bar, at the beach, it's all very different backdrops, different lighting. So if you choose somewhere like the bottom of your stairs or in a doorway at home, it gives you some context. Often people find that a clothes size is a good marker as well. And measurements can be useful, but again, don't overdo it because people can become obsessed by it. Once a month is completely sufficient. Generally, increasing your muscle mass may mean your clothes and measurements change, but your weight might not go down as quickly as you increase muscle and reduce fatty tissues. So just be aware of these things. After surgery, it's very important to make sure you commit to taking a vitamin and mineral regimen daily. This is to prevent deficiencies, either because you don't get enough from food or because you might not absorb as much, or a combination of both. In this area, GPs will not prescribe vitamins or minerals except for in exceptional circumstances, so they are needing to be bought over the counter. There are bariatric specific ones, but they are very expensive, and generic versions do exactly the same and will cost you somewhere between £100 and £140 a year in total. We really need you to commit to monitoring by having blood samples taken. So the hospital will take all the blood samples required over the 2-year period, and your GP is not required to do this. This is a list of vitamins and minerals required for a gastric bypass or a gastric sleeve. And what you will need is 2 tablets of a generic multivitamin from any of the big supermarkets or Superdrug or Boots. Iron tablets. Ferrous fumarate is the preferred, most gentle on your stomach version, but you can also use sulfate or gluconate. If you're having regular periods, then you'll need it twice a day, and we'll monitor how your bloods are doing. You also need to make sure that you're getting adequate calcium and vitamin D, and there are some examples of that. If you do have a history of kidney stones, then you need to make sure you tell your dietitian so that we can give you a slightly different preparation. And your GP, as mentioned before, needs to give you your B12 injection every 3 months. It's very important to make sure that you are spacing out your iron and your calcium, as they get absorbed in the same way, and therefore you might not be getting the benefit of both of them. Thank you so much for watching. We hope this has been helpful.